I'm at Constant Companion Animal Hospital and Veterinary Clinic today. I'm Jenny Williams, and you're watching Chelsea Living. Hey, so today I'm here at Constant Companion, which is in the Narrows in Chelsea, and I'll have to say, Scott, it is super nice here.
Yeah, it's we spent a lot of time trying to make this building open and welcoming, and
well, it's fresh, and somebody put a lot of time and effort into the vision of this design. I can tell.
I did the floor plan. My wife did the finishes.
Oh, okay.
Yeah.
So you can tell already that there's a lot of heart and passion put into this place.
Yeah, we quite a few years of planning to get to where we're at today. So very happy to be here.
Well, so with all of that planning, why Chelsea?
Kind of got to know the area just hiking around Double Oak and the Donovan Valley Trail, and I always knew I wanted to open a clinic, and then spent a lot of time just liking this area, and did see that I felt there was a need in this area for a vet, and really kind of when I saw this piece of property available, really kind of pretty quickly locked it up and started building.
Well, really for this location, it's fantastic because you've got everybody that is not all the way in Chelsea yet, but you can also service Chelsea. But you've got Greystone and Highland Lakes and everything down 41.
Exactly.
So, by the way, I love Donovan Trail myself. It's a great place to go. But yeah, so really it's a perfect location as far as servicing the growth of the area.
Yes.
So that was really smart. So I noticed on your website that it's mostly cat and dogs.
Pretty much all cat and dogs.
Okay, all cat and dogs.
Yeah, you don't want me working on your snake or something like that. So cats and dogs, 99%.
All right, so no farm animals like cows and pigs and.
No, not much. No farm animals.
Okay, because there are places that do service that. So
yes.
I love this specialty because most people are going to have a cat or a dog. So how did you, when did this passion for animals start?
So, I mean, the classic answer, right, is I've always loved animals. I think that's true. My uncle's a horse vet. So I saw the vet world. He kind of directed me away from the large animal life. And then really I was 21 years old, just working in a kennel, walking dogs, and decided it's kind of what I wanted to do. And then had to get my grades a little better to get into vet school, and got in, and then me and my wife moved back to this area. So it's been, I've been enjoying it ever since.
Well, good. So you've been here for several months.
Yes.
And right now, is there an ideal client that you're searching for?
Cats and dogs. If you have cats and dogs, I'd love to see you.
So a while ago, I asked him a question about what do I do about my kitten who is roaming. I mean, he meets every single neighbor. I've had to send, because so many people have taken him in, I've had to send dinners to so many people in the neighborhood surrounding mine. It's never in my own neighborhood.
Yeah.
It's always like way far away. And I think for most people, they think, oh my gosh, I need to keep him here because a coyote's going to get him.
Yeah.
But he always finds his way home. Is there anything special that I need to do to, one, either let them know that it's okay to let them go? I mean, can I put all of that on a tag?
Well, so yeah, outdoor cats, right? There's cars, coyotes, things can happen, but they like to chase squirrels and roam and do those things. So, I don't know a way to put a tag on them. Most cats probably aren't going to like a big
He's
passport.
Got his name and my phone number.
That's how they get a hold of you. Yeah.
Right.
No, I think that's probably about all you can do other than keep them in. Because once they get out, it's hard to tame a cat.
So, yeah, he is always out. And he leaves me squirrels every day. So he's a good hunter. Yes.
They're gifts.
Just sweet and just shredded up.
Yeah.
So what kind of, I also noticed that you do surgery here. And do you oftentimes have to keep your patients here overnight?
Yeah, so depends on the surgery. I do like keeping a lot of the surgeries overnight. So I can watch them throughout the day, make sure they wake up. And then B, the next morning, check incisions, check temperatures. They just, they're back to themselves the next day. And so that way it's kind of onus on us to make sure they're okay.
So mostly maybe one night stay would be.
Yeah, most. Every once in a while we have a something a little more involved, but
Okay.
the majority is one night.
Super curious. Like, what is your most common ailment?
Besides spays and neuters, we've done a lot of bladder stone removals the first 6 months. Done a few ACL repairs. Pulled a few socks out of some intestines. Yeah, your lab may, hopefully he doesn't do that.
Yeah, he loves socks.
But yeah, I feel like we've had a lot of bladder stone removals for the first 6 months, more than I would have expected.
So, what do you recommend for fleas and ticks?
So, heartworm is the one I harp on because
Okay.
it's one you can't see that kills. Fleas and ticks, I mean, my favorite product's NexGard. It's the one we sell. But HeartGuard and NexGard, honestly, they're the best and they work well. So, but there's a lot of good products out there, but those are my favorite for sure.
How often do you recommend people bringing their pets in for checkups?
Once a year. I think once a year, get your shots, see if there's something going on as they get older, right? If we start getting certain illnesses, we recheck those as needed. But most 2-3-year-old dogs, I think once a year's typically plenty to figure out what's going on.
Okay.
And obviously as things pop up, we see them more and more.
So I noticed one of your patient's owners popped in a while ago, and you really knew her animals. So do you get to know the animals?
And her we've seen probably more than she wants to see us.
Okay.
But yes, she has some kittens that were sick that are doing great. So
good.
happy to see that. Yeah.
Well, good. So what does your staff look like here? What kind of help?
So right now we've got 2 receptionists and 2 technicians. We actually have our 3rd technician starting Monday. And honestly, staff couldn't be happier with them. Really, kind of the goal is to provide a place that you can have a life and a career here.
Well, and it's a happy place to work. I mean, already just by being
here. The vet world's hard, with Saturdays and Sundays, so we don't have boarding. So the catch of that is I do think we get great staff that don't have to. Exactly. Yeah, it can have families and things like that a little easier.
Good.
So that's kind of the goal.
I wouldn't know what that's like. But so do you recommend that people get their animals microchipped?
Yes. When we've been open 6 months, we've had 15 people come in, and when we scan them, we can find the home right away. And when we can't, then, it's difficult, and sometimes we have to, pass them to the shelter or something like that to help them find the home. And the nice thing about having microchip is it's, we can connect pet to owner, within 10 minutes typically.
Oh, that's good. Do you have a typical price range that costs?
So the injection, and then if it's a lifetime enrollment, I think it's about $60 for the microchip, somewhere in that range.
Okay.
Yeah.
All right, good. So I have one last question. You hear people telling you all kinds of remedies, right?
Yeah.
When something ailment happens
Sure.
with your pet, and I just try to only believe stuff that comes straight from a doctor.
Sure.
But so, my kittens have brought home little baby snakes.
Okay. Yeah.
And most of the time I've seen that they're copperheads, but I try not to get too close. I'll run the other way when they are in their mouths and moving. But one did flare up. His face got big. And so somebody said that you could just give them a shot and that goes away if they get bit.
Depends on the snake. Depends on
lots of
if
variables.
It gets infected. A lot of variables. So I've seen some copperhead bites where it was you really didn't need much treatment, and I've seen some where it was a long hospitalization to get them better.
Okay.
But most snake bites aren't copperheads, and those are a little flare up, aren't that big of a deal. But yeah, it just all depends. I've seen the gamut of snake bites, from nothing to pretty serious. So.
Well, y'all, you can already tell that he knows a ton about what's going on with your animals, so that you'll be super safe if you drop by here at Constant Companion and introduce your cat or your dog to the friendly staff here and check out this place. It's so nice and clean. It's beautiful. So you'll at least want to do that. And how can they find you online?
ConstantCompanionVet.com.
Well, easy enough.
Yeah, Google it. Yeah, our number is 205-635-0313. So give us a call. We'd love to see you. Love to meet you.
Well, thanks so much for hanging out with us today.
Yeah, thanks for
And I appreciate it. I hope I see you on the trail one day.
Yeah, we may be.
Thanks for joining us. We'll catch you next time on Chelsea Living.